You all can see it.
Yeah. Thank you.
I'm going to have to leave early, so I just don't want people to think I was bored or offended. I just have to leave about 20 to 1. That's my time.
All right. Thanks, David. Well, hello, everyone. And we're looking really forward to our first Alliance meeting of the year. Our focus this meeting is going to be on policy and advocacy and kind of helping us prepare for the 2024 legislative sessions. We obviously recognize the importance of policies in shaping a resilient public health system, and having a series of speakers who provide us some updates on key federal, state, and local advocacy issues, with a spotlight this time on vaccination concerns. We think that's going to be one of the hot issues this legislative session. Of course, 2024 is a presidential election year, but because we also have the election of members of Congress at the state level, and we have elections for governors in 11 states and 2 territories. And of course, there are pivotal elections for legislators, local councils, and we now know that many of the other officials are important too, like judges around the country at all levels. We know that these elections will have impact on public health and advocacy equity around the country, and that we're something we're going to be following very carefully this year. I think I've lost my slides there. There we go. With this backdrop to the importance of civic participation and voting as a public health issue and on health in 20 legislative sessions, we wanted to have the opportunity to focus on the issues that we should be following in the next few months. Now, we're fortunate to have great presenters to provide that information to us. After they're going to give brief updates, we will certainly invite your active participation and sharing insights during the discussion period. And we should have time at the end of you to share your own legislative or policy-related priorities and any updates or news that you'd like to share with the Alliance. So that if you go to the next slide and show our speakers, I'm going to introduce each of them right before they speak. So I'm going to start first with our first speaker is Dara Lieberman. Dara is going to talk about her perspective about federal level policy. She is the Director of Government Relations at the Trust for America's Health. And in this role, she oversees the development and implementation of federal government relations strategies and works to advance and ensure implementation of TIFA's policy priorities. Previously, she served as a legislative representative of the American Counseling Association, where she advocated for mental health access, and has served as a staff member for the Senate Committee on Armed Services. Thanks, Dara.
Thank you, Dr. Benjamin. I am going to attempt to share my screen, and hopefully you can see my slides. So I'm going to be giving the federal policy issues that we are looking at that we think will affect public health and prevention this year. For those who are not familiar, Trust for America's Health is a nonprofit, nonpartisan public health policy research and advocacy organization based here in DC. And we try to advance policies that promote health equity and community health and population level health. So hopefully you can see a slide that says Congressional Outlook, starting with some of the big issues that we think will affect public health. And I will not be making predictions because we are talking about a razor thin margin in Congress right now, and getting anything done is extremely difficult. But of course, the biggest issue that I think affects all of your work is public health funding issues. And so we're dealing with both fiscal year 24 and fiscal year 25 at the same time. The biggest concern for public health funding right now is passing bills in general. We just saw the House and Senate leadership have agreed on overall, you saw them talk about top line funding agreement between Speaker Johnson and Senate Majority Leader Schumer. And so that includes all health spending that's not Medicare, Medicaid. And they still need to, once they agree to this top line, then the different committees get their allocations for how much money they'll have to spend. And then we'll want them to pass a full year spending bills for HHS. So because of a fiscal agreement earlier in 2023, if they still have a continuing resolution in place in April, then that could trigger major cuts to all kinds of different spending. So we're keeping an eye on that. So we have two big risks right now for public health funding. One is these across the board cuts if Congress doesn't pass full year bills. And then of course, I think we're all well aware of anti-CDC or anti-public health politics that could cause, fights over further cuts or rescissions of CDC money. We do, there is still a risk of a shutdown if they don't pass a continuing resolution or a full year spending bill. Right now, some appropriations bills expire this week and some expire in early February. Again, there was an agreement over the weekend to pass a 6-week extension to give Congress more time. But there still could be a window there where we see a shutdown. We know that the Freedom Caucus, the far conservatives in the House side want big spending cuts. Also pushing for some policy riders that could jeopardize these bills from moving forward, such as further restrictions on abortion drugs or prohibiting FDA from going ahead with menthol bans. So those are some of those policy riders that we're taking a look at. And of course, I spoke a little bit about major cuts that is going to be the biggest thing that I think public health advocates are going to be working on this year. And then the other important thing about funding bills is often they are a vehicle for authorizing legislation. That's the policy bills that we are following. The Pandemic and All Hazards Preparedness Act, or PAPA, that authorizes certain public health preparedness programs around medical countermeasures, as well as public health and healthcare response. Those expired in September. There have been short-term extensions of the things that really would sunset unless Congress says to, such as advisory committees on children, people with disabilities, older adults, temporary reassignment of federally funded workers like public health workers, and certain medical countermeasures programs. We hear that the House and Senate aren't even really negotiating right now. There's controversy about how the House bills have treated CDC as a separate bill and with some restrictions on CDC authorities. So right now those are a little bit stuck in committee. The SUPPORT Act is an opioid and overdose prevention law that passed in 2018. So that bill expired last year in 2023. Now it looks on both sides, it's fairly bipartisan efforts. So this is a bill that does have a chance of passing. But there are differences in funding levels between the House and the Senate. We're keeping an eye on the Senate version because it includes some ACEs prevention, adverse childhood experience provisions that we supported. It's got overdose prevention grants as well. Although we don't work directly on it, PEPFAR, the global AIDS funding is at risk because of controversy about abortion issues. And then the Farm Bill, many public health bill, but it includes SNAP and other nutrition programs. So that bill's, but there's controversy there about on how states can waive certain work requirements. So that hasn't been worked out. So we haven't seen drafts of either of those bills. And the current extension expires in September. There's community health centers and primary care legislation you may hear referred to as an extenders bill. In the House, it's called the Lower Costs, More Transparency Act. And that's community health center funding, National Health Service Corps, certain primary care bills. The Senate version actually has a higher price tag. And unfortunately, they use the Prevention and Public Health Fund money as an offset. So TIFA, APHA, and others have voiced concern over that. We don't want to cut prevention funding to pay for care. It's again a false equivalence there. And just outside of Congress, some other things that we're looking on. We've seen, well, within Congress, we have seen proposals to limit CDC authority, such as in the House, there's a proposal now that would require CDC to consider public feedback before making its guidance process. So that seems fairly innocuous, but we know that during a public health emergency, guidance needs to come out quickly, and pausing for a public comment period could really slow down responses. We also just saw a report out of Heritage Foundation last week that proposes splitting CDC into two separate agencies. One that would be, gathering good publishing epidemiological data, and the other for making public health recommendations. So we're seeing those kinds of proposals to get CDC to just be an infectious disease agency. So we are taking those very seriously, depending on which way Congress and White House goes next year. We're all waiting on menthol cigarette rules. TIFA and other public health groups are supporting the FDA's proposed ban on menthol as a flavoring characteristic to promote health equity and save lives. But that is apparently being held up right now. So that's getting a lot of pressure on both sides. Also on the good side, we do anticipate USDA finalizing school meal standards this year that align with dietary guidelines. I know these are not all vaccine issues, but these are sort of the big public health things that we're keeping an eye on at the federal level this year. Braidwood versus Becerra, I think a lot of our groups have commented on. This is the court challenges to the ACA's preventive services rule. I won't get into the impacts on vaccines, so Amy could talk about that possibly. And then, of course, the elections. That's sort of the bookend to the legislative cycle this year. So Congress starts to go away in August. Then they come back for a lame duck, and that's when all kinds of different ambitious or troubling, or depending on your perspective, legislation could quickly pass. And TIFA, I'm sure many other public health groups will be putting out our blueprint for the next administration and Congress in October. So keep an eye out for that. I will stop sharing my screen. My contact information is there if you have any questions.
Thank you, Dara. As many of you know, vaccination has been a prominent topic in national and political discussions over the last couple of years. And we know there's a number of legislative and other issues to follow in 2024. We've asked Amy Pisani to give us a quick update from the current landscape. Amy is the CEO of Vaccinate Your Family and will provide an overview of the primary vaccine issues that should be tracked during the 2024 legislative session. She's a distinguished expert in the field of vaccine advocacy and education, and had an absolutely remarkable tenure dating back to 1996, when she joined Every Child by Two, which is now, of course, known as Vaccinate Your Family. As Chief Executive Officer, he played a pivotal role in shaping the trajectory of immunization accessibility in the United States, and has worked tirelessly in driving force for immunization advocacy. And I try never to miss any of her policy calls. So, Amy.
Thank you, Dr. B. You're so kind. And I appreciate that you're always on our policy calls. We have been working on vaccines for quite a long time. I won't go too far into our history because I know we don't have a great deal of time here, but I do want to let you all understand sort of past as the future. And yes, I have been here since 1996. It was not my first job out of college, but one of my first jobs. I worked with the American Nurses Association for quite a few years, learning about vaccines before I ended up working with Every Child by Two. And it's an amazing organization. We do protect people across all ages. That's our goal. We did work on the childhood space for over 25 years, but of course, as vaccines were being invented for adults, we felt the need to, of course, you can't protect a child unless you're protecting their family. And that really started to come about during the pertussis outbreaks, when we were seeing like, you cannot protect a child from pertussis if their family is bringing it home. But then as more and more vaccines are being created for adults, we did expand our programs. I wanted to talk just a little bit about the past, because I do think we are circling back to this area as we're moving forward. And I think you're going to agree with me. I'm not going to get too detailed into the policy discussions today, because Dara just highlighted a lot of the areas that we're looking at. But I want to talk about the landscape. And I wanted to put the slide up here, particularly because I knew Dara was coming on the call. This was the first report we did with Trust for America's Health back in 2004. And it was a really important report because Our founders, former First Lady Rosalind Carter and former First Lady of Arkansas, Betty Bumpers, had been working on vaccines for over a decade at this point. They worked on it in the 70s, and then they worked on it in the White House while Jimmy Carter was in the White House. And they came back together and officially founded Every Child by Two at the time in 1991. This report laid out where those cracks were happening, where we still weren't reaching children. Yes, we were working on the VFC program, and the VFC program is now celebrating 30 years. It's unbelievable to think about that. But unfortunately, uninsured children are still less likely to be vaccinated than those who are insured or on Medicaid. So there are still cracks happening. And what this report was all about are the things that we all learned during the pandemic and started rethinking about. It talked about clinic hours. It talked about accessibility. It talked about where you were in your zip code. All the things that we know were the barriers to adults. And while we've done great things in helping eliminate disparities among children, we're not done yet, first of all. And secondly, my goodness, we have so far to go with HPV. We are years behind now on getting children up to date on HPV. But then also we have the adult space. And then this letter, I just was thinking it would be kind of fun to think about. This is what we're doing right now at Vaccinate Your Family. We're trying to think of the big ticket items that have changed the landscape of vaccinations and what can we do in the next 10 years to make something like that happen. So this letter was all about, the Clintons had obviously come into office. They had already been working with the Bumpers and the Carters for years on immunizations back when they were in the governor's mansion in Arkansas. But Betty wanted Bill Clinton to know, you know how you can find out about what's going on in immunizations? Go visit a WIC clinic. They're very welcoming. We've been to many of them, and you'll really get an understanding of what the country is dealing with across the nation. Now, almost there are, I think, 11 million pregnant people and children on WIC. The number is higher than that. I'm going to remember in a minute. And basically 50% of our nation is being served by WIC. The good news is back in 2000, that was the last presidential proclamation that Bill Clinton made requiring children to be scanned for their records when they go to their WIC certifications. And that's still happening today. It's an unfunded mandate on the USDA. And the truth of the matter is they love doing it. They feel, we've done surveys of WIC. We are the group that now educates WIC. Every year we have a training program for them. We have an online training program that has been done by thousands and thousands of WIC staff. But we talk about what's happening now, and CDC comes in and talks about what's the latest. And this was really essential if you think about it during the pandemic, because WIC are the people that are actually helping navigate the most vulnerable in our community vaccination services. So that was a policy initiative that happened so many years ago and is still working today. And what are we thinking about the future? Where are we going to go? Vaccinate Your Family works in communication. We do a lot of work there. We create toolkits. We try to help educate people on best practices for communicating about vaccines. Of course, policy, but community is really at the core. And it's not at the bottom of the slide by coincidence, but this is how we started. Betty and Rosalind traveled to every single state in the nation, and they listened. They tried to figure out what were the challenges in each community. And then they built coalitions, and the coalitions were of the willing. They may have been mayors, governors, people who worked in the agricultural extension programs, anyone who had any touch on the local community. And so now we're thinking to ourselves, you all know that our nation is never going to go back to the way it was before, where edicts came from on high, federal government said, this is what you should be doing, and everyone runs out and gets vaccinated. So what we're thinking about is how do we support those community-based organizations? We want to see community-based organizations continue to get federal funding. And this is a report that we put out in 2022, showing what they did with the money that was given to them, but the barriers that were put in place. So many CBOs couldn't apply for the federal funding. And so we want to see better proposals being put out by all the federal agencies that will open it up to very specifically to local community-based groups that can do a great job at reaching and navigating people to the systems that they need in order to stay on time with their vaccines. And then every year we come out with our State of the Immune Union report, which I will share with you as soon as it goes live. We're working on our 2024 version now. And it's visually beautiful and the staffers love it, but it really does talk about what are the barriers, what are we seeing as the major pieces. We want to see the vaccine injury compensation program expanded to all adults, for instance. We know that's a costly endeavor, but we think it's very important in order to continue to have confidence in vaccines, because they're not 100% safe and you should be compensated if you're injured. It talks about the 27 million adults who are not insured. And even though we had a great win whereby vaccines are now covered in Medicare Part D plans, as well as those on Medicaid, like there are 27 million adults who are out there, and we're hoping the Bridge program may be a good example of how we can reach them. But what does an adult program look like? So that's a big piece for us as well. We're talking about the importance of continuing to support pharmacists as vaccinators. And then federal standards for community health workers. And through our Vaccinate Your Family University, what we're going to be launching, we're already doing the trainings, but we're launching the university. We're training advocates. These are people who've been affected personally. They may have lost a loved one. They may have survived a disease. We're here. They're called our squad, squaring up against disease. If APHA has something going on the Hill or in a local community where these folks want to make a difference, they come to us. They have a story to tell. But the truth of the matter is what they just want to do is prevent others from suffering the way that they have. And so we do all kinds of events with them, but we also train them on media, but also we'll prepare legislative remarks. They'll report to different advisory committees. And then just to sum up, I just want to think back. We're thinking local community level. Community health workers are navigators. Not everyone's a community health worker. We have a huge group of people in the Good Health Wins Network, and Dr. Benjamin has been amazing at coming and presenting to that group. We're trying to help them understand anyone can be a navigator. And so we have a training program. It tells you, we don't want to throw people out to the wolves. Like when you're telling somebody about vaccines, you need to know the answers to the really tough questions. So we help them navigate all those questions. We help them show how can someone pay for their vaccines? What are they covered under? If they're on Medicaid, how do they get to their vaccines? So all of this is happening. We're thinking about what the priorities are going to be for the next 10 years. We have a big group session that we're pulling together in February with some of our partners to help us determine what we're going to be doing this year while Congress is fighting, whatever it is that they're doing. We're going to be planning, prepping, creating materials, working with our vaccination collaborative, and just moving towards reigniting a culture of immunization, which I think, we all want to see happen in this nation, people to love vaccines as much as we do. So, where we're at. Thank you.
Thank you, Amy. And we'll have some time for questions after we finish our next two speakers. I want to introduce Andy Baker-White. Andy is a Senior Director of State Health Policy at ASTO. In this role, he supports state and territory health agencies in advancing sound public policy by overseeing the tracking, analysis, and dissemination of legislative and regulatory trends, responding to requests for legal technical assistance. He conducts legal research and analysis and collaborates with ASTO's programmatic teams and partners. He also works to build state and territory health agency capacity to develop, promote, and implement sound public health policy in the legal and policy interventions. Andy.
All right, thank you so much, Dr. Benjamin. Can I just get a head shake from someone that you can see my slides? Just making sure.
Yes.
All right, thank you. So it's good to be here to kind of give you an overview of what we're going to be looking at during this upcoming legislative session throughout the states. My team for the last several years has done legislative tracking on a wide variety of public health issues. We also put together, let me see if I can advance the screen. There we go. All right. Our legislative prospectus series, which comes out at around December of each year. We just launched this one at the beginning of last month. Had the link there. I'll put it in the chat when I'm done as well. But it's a series of 10 documents that look at a variety of public health issues and where the state legislatures have been in the past year, kind of things that they've done underneath or within those areas, and then some of the things that we think that they might be working on for the upcoming year. I'm highlighting here 4 of those 10 that I think maybe the Alliance would have a little more interest in. But go ahead and check out, all of them there at the link. But the ones I'm going to be talking about today or kind of touching on today are the ones around our public health workforce, around containing the spread of infectious disease, optimal health for all or health equity, and then a little bit about data collection and the way it ties into health equity. And kind of where we're at right now, we're it's January 2024. Most of the states are entering their second year of their legislative period. New Jersey and Virginia will be starting the first year of their 2-year cycle. They're kind of the odd men out. And then a few states aren't having legislative sessions in 2024. They only have sessions every other year. So there won't be any legislation from Texas, North Dakota, Montana, and I'm forgetting Nevada and maybe one more. I can't remember off the top of my head. So for the vast majority of states, the bills that were introduced last year and were sent to committee, maybe has some hearings, are going to be carried over into 2024. So we will still be keeping an eye on the legislation that we were following last year and looking for anything new that's being introduced in those states. So really the first topic that we're going to be focusing on and kind of really keeping an eye on are issues around isolation, quarantine, and vaccines. We saw an emerging trend last year of quite a few bills in states that would have altered the authority of local and or state health agencies to order isolation and quarantine by either saying that rather than ordering isolation or quarantine, they could recommend isolation and quarantine. There was a bill in Iowa that would have just simply removed the quarantine authority of the state health official. And then, we're kind of seeing, that as kind of a trend, kind of modifying the ability of health agencies to use that really foundational tool of public health and a way to prevent the spread of disease. But we're also seeing states, look at ways to bolster isolation quarantine, the use of it. So in New York and Pennsylvania, there are bills that would, either have employment protections or would require paid family leave and other benefits for anyone who might be under one of these orders or be caring for someone who's under one of those orders. And then didn't want to get too much into vaccines, but we are tracking we're going to continue to track the legislation and follow what's happening there. But one area that we'll continue to keep an eye on that we've seen in over the last couple of years has been bills that would either remove or diminish the health agency's ability to determine or modify the school vaccination. What vaccines will be required for school vaccination requirements. So that's something we'll keep an eye out for, see if that happens again. That we were a little surprised about the number of bills that we saw that would have done that last year. Another thing that our members are interested in and that we'll be following this coming year are bills related to misinformation and disinformation. We're starting to track legislation that would integrate media literacy into classroom curricula across school level or across grade levels. We've seen some bills already in California, Hawaii, and Missouri to do that. And then New Jersey has a bill that would make the dissemination of misinformation professional misconduct for healthcare professionals. California had a similar bill like that. A federal judge actually temporarily blocked it. And then this past legislative year, the state there in California actually repealed that law. So that'll be interesting to see how those types of laws go, especially with some arguments around First Amendment rights and so forth, freedom of speech. Another topic area that's that we'll be paying close attention to is optimal health for all, or for health equity. So we'll be really paying attention to states where they maybe establish some sort of health equity advisory team, or have some sort of health equity initiative or project. So I just kind of put there some states that we've seen that have already introduced some bills to establish commissions or teams to help the health agency and the state government focus on health equity. And we've also noticed already in Vermont some health equity training for state corrections workers. So that's another kind of area that we try to keep an eye on, is when there might be some training or education requirements around health equity for state employees, contractors, and so forth. And then with the data piece, just trying to keep an eye on equitable data collection. So making sure that states are collecting the demographic information that can really help them understand and resolve health disparities. And then finally, the piece I'm going to touch on that that we'll definitely be following are issues around public health workforce. So we really highlighted last year the new law in Indiana that established a system for sustainable funding for state and local health departments. So we actually did a case study where we talked to folks who are on the commission that kind of looked into this issue, that reported back to the governor and to the legislature, and to the former legislator there in Indiana that really shepherded the bill through. So I'll look for that also, put that case study in. It kind of really shows you kind of how they worked on this issue, how they did it within their state. And then also we'll just be paying attention to legislation around the recruitment and hiring and retention of state employees, government employees, and how we can do a better job of finding and keeping our public health workforce. And then also states and looking for legislation that might increase pay, benefits, as well as the use of artificial intelligence. I think that is all I have. So thank you. So I'll pass it back to you. I'll put those links that I talked about in the chat, and I'm happy to answer questions at the end.
Thank you, Andy. We know that critical laws and policies often get started at our local governments. So I want to appreciate Adrian joining us to share policy and legislative issues that are expected to receive the greatest attention in communities around the country. Adrian is the Chief of Government and Public Affairs at NACCHO, whose mission is to improve the health of communities by strengthening and advocating for local health departments. There she leads the association's efforts on policy development, communications, and federal advocacy. She has prior experience working for the FDA, Food and Drug Administration, on Capitol Hill, providing direct services, community outreach, and program planning for community-based nonprofits, and conducting policy research and advocacy. Adrian.
Thank you so much. I realize my screen says that I'm sharing just the presentation, but yours looks at something different. So bear with me. As you can see, all the slides on the side. Hi, everyone. My name is Adrian Castellati. As Dr. Benjamin said, I'm so pleased to be with you here. And thank you to my other colleagues who are speaking. NACCHO represents the over 3,300 local health departments across the country, sitting in all states except Rhode Island, and impacted by all the policies we've heard about today. So NACCHO, we work at the federal level, primarily on behalf of the local health departments. But really, when you get down to at the local level, they're working to make policy changes that the feds have implemented, that the states have implemented, trying to make those things work on the ground while addressing the needs of the community within the bounds placed on them through those rules, those laws, and funding constraints, as well as issues at their local county commissioners or mayor's office, however they are structured. So it's important to recognize that local health departments do a lot of things. They do a lot of every little piece of public health that you think of, and then more. And because they work in all facets of public health and they're partnering with healthcare providers, with CBOs, with other aspects of local government, with the education system, that means that the policies that can be impacting them that we're going to be working on at a local level really can span a host of different issues. There are examples everywhere across the country of local policy efforts, including traditional efforts like taxing tobacco and sugar-sweetened soda, or sugar-sweetened beverages to curb use, indoor smoking regulations, partnering with transportation and housing to address social and environmental aspects of public health. It really goes on. And every community is different, of course. But the job here is not to say that every community is different. It's to talk about some of the things that we're looking at in 2024. So these are not in any particular order, but really want to go through a host of different types of issues that folks have been focused on for 2024. Tobacco is a huge one, including flavors, vaping. There are bans that stood up in like Portland starting the beginning of this year, and other things at the local level where there really is some innovation and push to get these things done. While, as Dara said, the efforts at the federal level right now are, I don't want to use the term stalled, but incredibly slow is my optimistic way of thinking about it. A big one that talks a bit about what Andy was speaking about, but really impacts at the local level is authority. There are so many different types of legislation that's either been proposed or enacted, even at the local level, that takes away public health authority and really makes it challenging for local health departments to do their jobs. For example, we have, there are bills that are based on like personal freedoms, which essentially takes away the public health tools that the health department has on all sorts of things. It talks, there are efforts to try and say that health departments can no longer close a business, say if they, let's say there's a outbreak, a foodborne outbreak at a restaurant, taking away the authority for folks to be able to actually say, you need to close down until we can figure out what's going on, under this guise of personal choice and trying to really take the tools that were used in COVID and roll those back. We're also seeing in some areas, and this is why local elections really, really matter, where folks have taken over local boards of health or taken over county councils explicitly to remove or curtail public health authorities and try and oust the health official, for example. There's ongoing litigation on that in one case in Ottawa County, Michigan. That's a case that's getting a lot of traction publicly, but it's not the only place where this is happening across the country. We were also hearing from local health departments around the really varying and ever-changing world of marijuana decriminalization enforcement. This oftentimes comes down to those local decisions and local policies, and really also has an impact on public health. Opioids and substance abuse prevention. I think the thing that comes to mind for a lot of folks in this space is needle exchange programs and syringe service programs. It also comes down to access to naloxone. Safe injection sites is a newer issue in the United States that has come up that certain communities are trying to pursue. So this is another area, folks are dying. They are getting sick from the infectious disease complications of substance abuse. And so they're trying to find ways to put in risk reduction measures to try and keep people as healthy and safe as possible, and also getting them linked to services. The post-COVID infrastructure. So while a lot of this has to do with the resources that come from either the federal level or the state level, we know that a lot of local health departments are facing a funding cliff, and this is the same that we talk about at the federal level a lot. And so the question is, if we've built up these structures, if we've built up these great relationships, connections to community-based organizations and other outreach work that's really strengthened the networks of public health, how can we support those in the absence of funding? And that ties into funding priorities. We have seen time and time again the boom and bust cycle of funding. Dara pointed to it at the federal level, but this happens all the way up and down the chain. And unfortunately, I think many of us, what year is it, 2024? I'll give it 3 years ago. We're real excited that maybe this could be the time we stop the cycle of boom and bust funding for public health. I don't think we were. I think we were a little bit too optimistic. And what we are seeing is a continued downslide now. And so those decisions at the local level of how to spend their local funding really matter as well, to see what public health will be able to do in the future. Less big P policy is DEIA efforts. There are multiple communities that have been able to declare public health racism as a public health crisis, but what to do after that has been a real question. It's not just enough to have it on paper or to say it in a declaration, but some of the action that comes after it. So there's been a lot of work internally at health departments and in local government about, if that's the case, how are we going to improve our internal policies and procedures in order to move the needle forward to address that public health crisis. Climate-related policies and environmental health impacts, this comes up a lot, especially in states that aren't necessarily doing as much around climate. Localities do still have ways to engage. Maybe they don't call it climate change, maybe they just call it extreme weather events. Maybe they are on the coast of California and worried about their beach washing away and half their community falling off the side. So maybe that was just when I worked in California. But there's lots of efforts around mitigation that and preparedness that are really important around climate and the impacts that they see from natural disasters and other health impacts. Data privacy in the context of data memorization, data sharing, cyber security, those areas, again, maybe not big P policy, but are things that local health departments are dealing with right now to try and ensure that we can do the data sharing that's absolutely critical for local health departments and local providers to do their job, but also do so in a way that keeps those data secure. And for a lot of local health departments, their structures are based on what the local government system uses. And so making sure those are strong enough for what we need in a health space. And then finally, just an asterisk, I am not the expert on this piece, but it's important to know that right now we are still dealing with tons of judicial rulings that are impacting policy at the local level. And this is particularly important because a lot of these cases are cases that came from the pandemic, during the pandemic, and just the wheels of justice are slow. And they are hitting now in 2024, but the impacts of those rulings can really gut not necessarily the COVID response, but really the response to any sort of crisis. So that's also something that they are working with and dealing with. And I will tell you, local health departments, some of them have really talented public health lawyers, and some of them are relying on the lawyer for the county who doesn't necessarily have any public health experience. And so we're working really hard from NACCHO's perspective to make sure that we're building up capacity there. We have convening coming up, for example. Quick plug if you want to come to New Orleans and hang out and learn all about public health law. But this is an important piece too, because it's not each health department doesn't necessarily have the same level of expertise to be fighting these judicial challenges. And I will just say, as I mentioned, though, we are really also focused at the federal level, just to echo some of the things that Dara said. We have a ton of work to be done at the federal level. I put some slides in that I'm happy to share with others, including our legislative agenda. But I am happy to turn it back over to you, Angie, or to you, Dr. Benjamin.
Thank you. Yes, I'm going to turn it over to Angie, and thank you very, very, very much.
Thanks all. So this is your time to ask a couple questions of our presenters if you would like. And then we really do want to hear from all of you all. Are you thinking about the same issues? Are there others that we haven't brought to the table yet that really our alliance should also be following? But just to echo, thanks to our 4 panelists. They were really great. And I know I learned a lot. So if you all want to raise hands, or you can add questions in the chat room, and we'll try to get to them in the order I see them. Yes, Anne.
Hi, thank you so much for the presentations, and hello to Dara and Adrian and other colleagues, past and present. So I wanted to tie together Dara's presentation and Adrian's, especially around the DEI issues and equity issues. I wonder if you could just talk a little bit more about, in particular, what we anticipate in terms of, problematic policies, writers and the appropriations cycle. Also would call out specifically in addition to like anti-racist pushes, like anti-trans. So would love to just hear your comments and thoughts on that.
Dara, you want to go first?
No, you can go ahead.
Well, I guess if you don't mind, I'll speak at the federal level because that's really where we do most of our work and where we're going to see a lot of these things, particularly in 2024. Dara laid out beautifully the craziness we're dealing with right now in the sense of appropriations, where, deals are being made. It's January of 2024. We still don't even actually have a proper appropriations for 2024. And one of the things that Speaker Johnson has hung his hat on and going back to his caucus saying this was the best deal I could get is that there's still policy riders to be negotiated. And they didn't gain much ground when it came to top line numbers from the McCarthy deal of the spring. And so this is where he's putting a lot of his at least speaking about like where they can make a difference. Imagine anything and they could be trying to throw this spaghetti at the wall. Certainly we have seen, and we saw during the Trump administration, intense scrutiny of anything that said DEI or DEIA in them, anything that specifically called out racism or worse, anti-racist. And so potentially pulling back funding from any of those programs, saying that you can't give money to programs that are explicitly saying that they want to be doing anti-racist things. All of those are potential policy riders. They're going to have to decide what's the most important to them, and then it'll be important for the Senate to figure out what matters there and what they're going to push back on and what they won't. But there's lots of opportunity there. And then the trans piece is really interesting in the sense that it's been made one of those kind of political rallying calls of trying to motivate voters around, girls in sports and whatnot at the state level, especially. But we certainly could see other pieces around trans medical care, especially for kids, which is where they've put a lot of their efforts to date.
Anything to add?
No, nothing to add. I mean, anti-immigration fits in with this as well. So we often see a control F approach to law writing right now, where they look for certain buzzwords and take those out, and it could really dilute the equity impact of legislation. So I can't imagine what other things could come down the pike yet.
Yeah. And I think Anne just pointed out one, that maternal and child health policy is now being seen as woke by some congressional members.
Yeah.
So certainly another piece
Yeah.
about.
Yeah. And I don't know how current that is. That was like my understanding is that we ran into some tailwinds at the end of last year when we were trying to do the year-end package around that. So that is like a little bit older, just in terms of intel, but I thought it was worth pointing out because obviously, as we all know, maternal health is a major public health issue. And so the fact that it is seen in a light that is problematic for some in Congress is an issue.
And you know this better than most people. Members of Congress are being asked to vote on things incredibly quickly, and most of them don't have a chance to really dig into what those things are. So all you need is a rumor that something is too woke, or a rumor that something's secretly about abortion, and that can sink an entire bill. There was a child marriage bill that sailed through the Senate. It got to the House floor, and someone said, "Oh, by the way, this actually has sneaky sections about abortion in it," that did not exist. And it sunk the entire bill. And they had to come back a couple weeks later after they had walked everyone through line by line to say that this had nothing to do with it. But just the whiff of some of these things, unfortunately, can really stick. And so that's why it's so important for us as advocates to really be on top of these things to try and head off some of those potential complications.
Thank you. No, that's great. Vishwa, I see you next.
Yeah, thank you so much, Andy, for making me ask question. I need to ask to Mr. Andy, who's given a wonderful presentation from the ESTO department. as I am an international student, so like we are having very difficult situations to find a job in the public health sectors, and your priorities were to recruit public health workforce. So as a student like me, how you can manage the workforce or new recruitments for this year?
Yeah, we do. ASO does have a job board that we that we open to our members, the different state and territorial or health departments across the country. So they do use that. I'll find that and I can put that a link into the chat. But that's usually you know, for job postings that are all across the country that our state and territorial health departments have open. So
Because as an international student, it is very difficult for us to get a job in the United States. So that is the main issue that every person is finding in the public sector, public health sector nowadays.
Thanks, Vishwa.
Let me add that it's important that international students work on getting their visas in early. The process is slow, and I can tell you that we have lost employees who we wanted to keep because their visa process just takes so long. So the challenge is getting them in early and getting a good attorney to bird dog those, because that's the rate limiting step.
Thanks. Amy, I see your hand.
I just wanted to mention, we were talking about rumors and how we need to get ahead of them. I think, Adrian, you're right on there. I don't know, we're talking vaccines here. So for those of you who may have seen at the state level, those people who walk around with the signs, they're black signs with red lettering, and they have all kinds of allegations on them that are incorrect and false. We have the answers to all of those. And so very simply, what I did when I was testifying in my own state where we were trying to remove our non-medical exemption, which we won, I literally handed this piece of paper that listed all of the answers to all of these erroneous rumors that they were walking around with to each legislator that was on the committee. So we do have things like that. They're behind a password protected portal, but if you're dealing with vaccine rumors, or you need the answer to something, please go ahead and send me an email at amy@vaccinateyourfamily.org. We also have what's called the Legislator Archetyping Toolkit, which is also behind a firewall, but it really talks about, you're walking in the door. What is this legislator about? Did this legislator vote for this type of legislation? Is this legislator a dentist? Is this legislator a business person? How do you angle in with them, and how do you talk about vaccines without it becoming a controversial issue? So that's something that we'd be happy to share with you all as well.
That's great. Thanks so much, Amy. I would just say I want to open it up to everybody, though. I know we had some great reports on kind of what people are following for 2024. If you or your organizations have any of these, please share them and we'll make sure that we send them along to everybody. But just wanted to ask everybody, are there any other issues today that we have not talked about that you all are following, or things that you just want to make sure that are kind of at the front of our minds as we're moving into this legislative session?
Can I just add, I saw in the chat some folks are talking about the words equity, and I know that we've had the issue with climate change. We have certain states where local health departments can't talk about the COVID vaccine, for example. And I think that there's a conversation about how creative can you get. And I think a lot of local health departments get very creative of what they call things, or how they can get to the end goal of achieving X public health outcome. And sometimes it can get tricky to go through, like, well, do we want to call it this? Do we want to call it that? But sometimes keeping in mind what's that end goal, at least at the local level, that's where they've been able to move the needle and be creative. So you can't talk about COVID vaccination, but you can get the local hospitals to talk about COVID vaccination, and you can just talk about vaccines. Or you can talk about go look and see what your hospitals are talking about. So finding ways around that, talking about natural disasters when it comes to climate issues, focusing on some of the other issues as opposed to just infectious disease. So there's lots of things that we can be doing. And then, as Dara had mentioned, there's a lot of attack right now at the federal level on chronic disease. And should we be doing that? Should CDC be doing that? And so how we can link some of these things together to better protect public health as a whole are going to be really important.
Thanks, great point. And I would just say, after just some of the discussions we've had, or people have mentioned today, I think having a discussion at some point this year around some of these court decisions and the impacts that they're having might be something that we want to do also. So stay tuned for that. But
Angie, there's
yes.
I just wanted to mention, there's a conference happening in April that it's all about the legislative barriers. I'll send you an email about that. It's happening up in Boston.
Great, thanks. Guessing it's with.
And I see the note about the Communications Collaborative having some talking points there too.
Yeah, great. Okay, I see a couple questions. Let me see. One around, I think a good question for Michelle, are there bills around public health and AI that we should be thinking about? I know a couple people mentioned it, but if anybody knows any, please send them to us and we'll share them with the group. I know we are right at 3. So feel free to either just send them to us or alliance@apha.org and we'll share them. But want to once again thank our 4 presenters. I know I learned a lot. I really feel like I'm a little more ready for the year. And I look forward with all of you all to having a chance to think about how we can address these over the year to come. So thanks everybody. And we'll look forward to talking to you in February, where we're hoping to really focus on some of the transformation activities and work that states have been doing. So we'll be in touch about that. Bye, everybody.
Thank you for having
Thanks
me.
so
Thank
much.
you.
Thank you. Really appreciate it.